Hello guys, welcome to the channel Health Tricks and Tips in English, the best pregnancy-centric channel. In this video, I'm going to tell you 14 such signs that tell that the baby inside the womb is not developing properly. There is some potential problem that the baby is facing inside the womb. What all are those symptoms and signs? Number 1. If you are feeling any abdomen pain or cramping, then this can be a sign of a problem with the baby. It can be a sign of growth restriction or the birth defect, or a problem with a mother such as preeclampsia or infection. Number 2, vaginal bleeding or spotting. So this can be caused by a number of things including a miscarriage, an ectopic pregnancy, or a problem with the placenta. Number 3 is abnormal fetal growth. Now this takes into the point like the baby is not developing properly as per the gestational age. The baby is either too small or very large. This could be an indication that the nutrients are not flowing properly from mother to the fetus. The number 4 is the reduced fetal movement or the lack of the fetal heart rate. The baby should be moving and growing regularly throughout the pregnancy, and the mother should be able to feel the baby's movement. If the baby's movement slow down or stop, or if there is no fetal heartbeat on an ultrasound, then it is a sign that the baby is having some trouble inside the womb. Number 5 is the abnormal result on prenatal screening test. So prenatal screening tests such as ultrasound and blood test can help identify potential problem with the baby's development. For instance, an abnormal nuchal translucency measurement on an ultrasound can indicate an increased risk of Down syndrome and other chromosomal abnormalities, while an abnormal result on a serum screening test can indicate a higher risk of certain birth defects or genetic disorders. Number 6 is the size of the uterus. Either it is too smaller or larger than expected for the stage of the pregnancy. Now this indicates a problem with the baby or the pregnancy, such as the miscarriage, a growth restriction, or a birth defect. Number 7 is amniotic fluid leakage or rupture of membrane. Leakage of amniotic fluid or the rupture of membrane that surround the baby in the uterus can indicate a problem with the baby or the pregnancy, such as the birth defect, a problem with the placenta, or preterm labor situations. Number 8 is the high blood pressure or the preeclampsia. Now, this is a serious complication of pregnancy characterized by high blood pressure, excess protein in the urine, fluid retention, and swelling. Now, this can be caused due to a number of reasons, including a problem with the baby or the placenta, a genetic disorder, or a problem with the mother's blood vessels. This is a serious problem and need immediate medical attention. Number 9 is change in the shape or the size of the uterus. Now, this indicates a problem with the pregnancy such as ectopic pregnancy, a birth defect, or miscarriage. Number 10 is incompetent cervix. This is a condition where the cervix becomes weakened and begins to dilate prematurely, which can lead to spontaneous abortion or preterm delivery. This condition often may not be having any symptom, but it is detected during routine prenatal examinations. Number 11 is the presence of certain markers in the blood of the mother, like the high glucose level, which can be an indication of gestational diabetes. In order to maintain your high sugar level, you should be eating very less sugar, or sometimes you have to avoid it completely. That depends upon your gynecologist, what your gynecologist advise you. Number 12 is a fever or infection, and this indicate a problem with the baby or the pregnancy, such as birth defect, a problem with the placenta, or a uterine infection. Number 13 is abnormal level of certain substances such as alpha-fetoprotein in mother's blood. High level of AFP in the mother's blood can be a sign of certain birth defects such as either Down syndrome or the neural tube defects. Low levels of AFP can also be a sign of problems such as miscalculated due date or an ectopic pregnancy. Now 14 and the last one is the multiple pregnancy. So if you are having multiple pregnancy like twins and more than twins with the same fertilized egg, and this is a big thing, and in these situations the baby needs to be monitored regularly. More often you have to visit your doctor because a lot of aspect has to be taken care when you are having multiple pregnancy. The weight and the size of the mother and the baby needs to be monitored, and often in multiple pregnancy you will see more problems. So we have 14 pointers here which almost indicate that the baby inside the womb is not growing properly, or the baby is having any problem, or your pregnancy is not running smooth due to some of the reasons. But these are only the signs and the symptoms, and necessarily does not mean that there is a problem with the baby or the pregnancy. Some women will experience it, some may not be experiencing it. So best thing is to be in consistent touch with your gynecologist for any potential problem. How did you like this video? Do tell us in comment section. Kindly subscribe or follow us on YouTube as well as on Facebook. Thank you for watching this video. Let's catch up in another video on pregnancy. Till then, peace out. Stay happy. Stay healthy.